Good morning, afternoon, or evening, everyone. My name is Agatha Rani, and today I am pleased to present our research entitled Enhancing Urban Wellbeing Through Digital Innovation, a community-based mental health platform. Mental health has become one of the major challenges in urban societies, especially among young adults who experience increasing academic, professional, and social pressures. While awareness of mental health has improved, many people still face barriers in accessing support that is affordable, engaging, and free from stigma. In response to this challenge, we developed Sijiwa, a community-based mobile application that combines artificial intelligence, community interaction, and geolocation technology to encourage healthier lifestyles and improve mental well-being in urban environments. Today, I will explain the motivation behind this research, introduce the proposed solution, describe our methodology, and finally discuss the evaluation results and future work. Let us begin with the motivation behind this study. Today, cities in Jakarta are growing rapidly. Urbanization creates many opportunities for education, employment, and economic development. However, it also creates new challenges that directly affect people's mental well-being. Many residents experience daily stress from traffic congestion, air pollution, crowded living conditions, long working hours, and increasing social expectations. These conditions contribute to higher risks of anxiety, stress, and depression compared to people living in less urbanized areas. According to national statistics, approximately 1 in 5 young adults in Indonesia experiences a mental health condition each year. Despite this number, many people still hesitate to seek professional help because mental health services are often perceived as expensive, inaccessible, or overly clinical. At the same time, social support plays an important role in improving emotional resilience. Having a supportive community often encourages people to cope better with stress and recover from emotional difficulties. However, after reviewing existing applications, we found that most digital mental health platforms mainly focus on individual activities, such as mood tracking or meditation. Very few integrate social interaction, AI assistance, environmental recommendations, and gamification into one ecosystem. Therefore, our objective was to design Sijiwa, a community-based mobile application that supports urban mental well-being through the design thinking approach. Besides providing practical value, our research also contributes to SDG Goal 3, which promotes good health and well-being, and also SDG 11, which focuses on sustainable cities and communities. This slide presents the main features of Sijiwa. Rather than functioning as a simple journal application, Sijiwa was designed as a complete ecosystem that encourages users to care for their mental well-being through personalized and engaging experiences. The first feature is personalization. During onboarding, users select their hobbies and interests before customizing a virtual pet. This virtual pet serves as an emotional companion throughout the user's journey, making the application feel more friendly and less clinical. The second feature is journal. Users can either write daily journals or communicate with their virtual pet through a chat interface. These conversations are analyzed using an LLM-based natural language processing model, which identifies emotional patterns and summarizes the user's mood. Based on this analysis, the application provides personalized recommendations that are relevant to the user's emotional condition. Importantly, all personal data is encrypted, processed only with user consent, and never shared with third parties. The third feature is Jackpools. This feature combines mood analysis with geolocation technology. Instead of giving generic recommendations, Jackpools suggest nearby green spaces that match the user's emotional needs. For example, someone experiencing stress may receive recommendation for quiet parks, while users with higher energy levels may be directed towards recreational spaces. To encourage users to actually visit these locations, they can scan QR codes on site to collect coins that can later be redeemed. This gamification approach aims to increase user engagement while encouraging healthier outdoor activities. Another unique aspect of Jackpools is the community emotional heat map, which anonymously visualizes emotional trends across Jakarta without revealing any personal identities. Finally, Sejua includes an anonymous community feature. Here, users can share experiences, seek emotional support, or participate in community organized well-being activities while remaining anonymous. This anonymity helps reduce stigma and also allows users to express themselves more openly. To ensure that the application truly addresses user needs, we adopted the design thinking methodology. This framework consists of 5 stages: empathize, define, ideate, prototype, and test. During the empathize stage, we conducted in-depth virtual interviews with 4 participants between the ages of 19 and 21 who live in Jakarta. From these interviews, we identified several common problems. Participants expressed difficulty finding emotionally relevant support, limited awareness of nearby green spaces, and a preference for applications that felt supportive rather than clinical. During the ideate stage, we used brainstorming sessions and how might we questions to transform these findings into concrete features. We then created wireframes before developing a high-fidelity interactive prototype that included all major functionalities. Finally, we evaluated the prototype through 2 rounds of usability testing, each involving 10 participants. To measure usability, we used 2 standardized instruments. The first was the single ease question, or SEQ, which measures how easy users feel each task is to complete. The second was the system usability scale, or SUS, which evaluates the overall usability of the application. The results were encouraging. Our prototype achieved an average SEQ score of 5.56 out of 6, indicating that participants found the application easy to use. Meanwhile, the average SUS score reached 84.17 out of 100, which falls within the excellent benchmark. Based on participant suggestions, we improved the prototype by adding a search filter in Jackpools, introducing an emotional map, and making green spaces categories more visible before conducting the next testing iterations. These iterative process demonstrates how user feedback continuously shape the development of Sijiwa. In conclusion, Sijiwa combines AI-assisted journaling, a virtual companion, anonymous community interaction, gamification, and geolocation-based recommendations into one platform that supports urban mental well-being. Our usability evaluation suggests that users found the platform easy to use and engaging, indicating strong potential for future implementation. However, this research has several limitations. Our participant sample are relatively small. The evaluation focused only on short-term usability, and the AI companion components has not yet undergone clinical validation. For future work, we plan to involve more diverse participants, conduct long-term studies, evaluate the AI model in real-world settings, and collaborate with mental health professionals for clinical validation. That concludes our presentation. Thank you very much for your attention.